Welcome to Chapter 9, Marketing, Developing Programs that Respond to the Wants and Needs of the Priority Population. This chapter explores how to use marketing principles to plan, promote, and improve public health interventions. When used ethically and strategically, marketing becomes a powerful tool to reach people, shift behavior, and build healthier communities. Let's begin with the basics. Introduction to social marketing. First is, what is social marketing? Social marketing is the use of commercial marketing principles to influence health behavior for individual and community benefit. It focuses on voluntary behavior change, and it puts the priority population at the center of planning and decision making. Second is, how does it differ from commercial marketing? In commercial marketing, the goal is to sell a product for profit. In social marketing, the goal is to improve health and social outcomes. Third is, six key characteristics make social marketing unique. 1. It creates behavior change that benefits individuals and society. 2. It uses audience segmentation to tailor efforts. 3. It focuses on the priority population's needs and wants. 4. It applies the marketing mix, product, price, place, and promotion. 5. It involves pretesting and refining strategies. 6. It includes continuous monitoring and evaluation. Social marketing is not just promotion. It's a complete planning approach focused on understanding the audience and offering them something they value. The marketing process and exchange theory. Let's explore the exchange process, the core idea behind marketing. Exchange theory states that people are more likely to adopt a behavior if they believe the benefits outweigh the costs. First is, the buyer is the priority population. They decide whether or not to buy in. Second is, the seller is the program planner offering products, services, or behavior changes. Third is, the program must create value or the sale won't happen. For example, to promote breastfeeding, the planner must understand what mothers value like bonding and infant health, and what barriers they face like time, discomfort, or lack of support. This is where consumer orientation comes in. Program decisions are guided by research on what the population thinks, feels, needs, and prefers. This involves consumer analysis, what people value, market analysis, who else is offering services, channel analysis, where and how people access information. Finally, competition matters. You're not just competing with unhealthy behaviors, you're competing with other services, beliefs, and distractions. For example, a smoking cessation program must compete with stress relief, social habits, and even nicotine addiction. Segmentation. You can't reach everyone with the same message. That's why marketers use segmentation, dividing the priority population into smaller, meaningful groups. First is, segmentation helps programs be more efficient and relevant. Second is, it helps tailor strategies to people who are most ready or most in need. Here's the 5-step segmentation process. Step 1. Identify health-related behaviors contributing to illness or death. Step 2. Choose which behavior your program will target. Step 3. Identify variables that influence that behavior. These can be demographic, age, income, gender, geographic, where people live, psychosocial beliefs, values, personality, behavioral, what they do or don't do. Step 4. Group people with similar characteristics. Step 5. Choose which segment to prioritize. Use 5 criteria: measurable, substantial, accessible, differentiable, actionable. A good example is preconception care, where one program might target college age women with low awareness, while another targets first time fathers. The marketing mix, the 4 P's. At the heart of every marketing plan is the marketing mix, also known as the 4 P's. Product first is, the product is not always a physical item. It could be a behavior, a service, or an experience like attending a workshop or getting a screening. Social marketing distinguishes between core product, the benefit the person gains, for example, peace of mind, better health. Actual product, the action being promoted, for example, walking daily. Augmented product, the additional services or incentives, for example, a walking app or reward points. 2. Price second is, price is what the individual must give up, not just money. It could include time, effort, embarrassment, or lost convenience. If the perceived cost is too high, they won't buy. Planners must reduce barriers and ensure that benefits outweigh costs. That's why pricing strategy is as much about removing obstacles as setting a literal price. 3. Place refers to where and how the priority population accesses the product or service. It could be a physical location, for example, clinics, schools, a digital space, for example, a website or a mobile app, or even through a trusted person, for example, a community health worker. Convenience and accessibility are key. 4. Promotion is how you communicate your message and motivate action. Promotion includes advertising, print, digital, or broadcast media, personal selling, peer education, or one outreach, sales promotion, discounts, giveaways, incentives, public relations, media coverage, storytelling, digital communication, social media, SMS, email. You must also consider message framing, tone and appeal, timing and placement, creative design and delivery. Pre-testing. Don't launch your message until you test it. Pre-testing is the process of trying out materials, concepts, or messages with real members of the priority population before full implementation. First is pre-testing ensures that the message is clear, relevant, and motivating. Second is it saves time and money by catching issues early. Third is it increases the chance that your message will work. Pre-testing involves two phases. Phase 1 test the product concept or idea. Phase 2 test promotional materials or delivery channels. Include members of the target population, subject matter experts, community gatekeepers. Use methods like focus groups, pilot programs, interviews, usability testing. Even with a tight timeline, pre-testing is non-negotiable. Continuous monitoring. Once launched, your job isn't done. Continuous monitoring means tracking the progress of your marketing plan and making adjustments based on feedback. Ask, is the message reaching the audience? Are they responding? What barriers remain? Should we change the channel or the tone? This helps keep the program responsive, relevant, and on track. To summarize Chapter 9, first is marketing is more than promotion. It's a full planning approach rooted in audience understanding. Second is exchange theory drives behavior change. People must see value. Third is segmentation allows you to tailor efforts efficiently. Fourth is the 4 Ps: product, price, place, and promotion shape how people interact with your program. Fifth is pre-testing saves time, improves messaging, and increases impact. Sixth is continuous monitoring ensures the plan stays effective and responsive. Social marketing blends science, empathy, and strategy, putting the priority population first. Thank you for watching this video. This concludes Chapter 9, Marketing: Developing Programs that Respond to the Wants and Needs of the Priority Population, based on planning, implementing, and evaluating health promotion programs by James McKenzie, Brad Neiger, and Rosemary Thackeray. Stay tuned for Chapter 10,